Sit on a yoga bolster or some blankets. Hold the strap, put the buckle in one of your hands, holding the strap with your arms spread into a V shape. Inhale, bring your arms up, lengthening your spine. Exhale and bend to the left. Keep your sit bones down into the bolster. Feel the length on the right side of the ribs. Taking a breath into the right side and then exhaling and holding the stretch. Do 2 to 3 breaths. When you're ready on an inhale, come up. Exhale, go to the other side. Take a breath into your left ribs, feeling that opening. This mobilizes the spine in lateral flexion. It stretches the quadratus lumborum muscle. It stretches the intercostal muscles. This makes more space for babies to assume a better position in the pelvis. Now you can hold the strap, putting the buckle in one of your hands while holding the strap. Place one hand near your sacrum and send your other hand high. Gaze at your upper hand. Bring your shoulder blades together. Keep both sitting bones down. Feel the tone in the back muscles. Feel the stretch. Feel the opening of the ribs. This can help to relieve upper back pain, keeping your breath going. When you're ready, release. Do the other side. Head gazing at your hands, ribs open, shoulder blades together, sit bones down. When you're ready, come out of that and use a blanket underneath you. And come into a sitting position with your feet together and your knees apart. We're going to do cat-cow in a seated position. You can grasp your ankles, be on your sit bones, take a breath in. As you exhale, round your back, round your nose down towards your toes. Breathe in and arch up. Head goes up toward the ceiling, not too far back with your neck. Heart space open. Exhale and reverse. Pelvis moves back. Baby hugs in. Spine rounds into a C shape. You breathe in. Baby moves forward. Pelvis moves forward. Open your chest. Look gently toward the ceiling. Move back and forth, coordinating your breath. Exhaling as you round. Inhaling as you open the front line of the body, mobilizes the spine in extension, stretches the pec major muscles in front. Exhaling and rounding, mobilizes the spine in flexion. Being conscious of your pelvis moving in both directions. Couple more. Remembering not to do this if you're having any pubic bone pain today. Now we're going to do a seated twist. Keep your bottom on the edge of some blankets just to help your pelvis be in a better position. So you're sitting tall on the rolled up blankets. Place the sole of your right foot inside your left thigh. Send your left foot behind you. Your shins are on the floor. Place your hands on your thigh. Inhale, use your arm strength to lengthen your spine, and then exhale as you twist your core to your right. You're twisting toward the foot that's behind you. Inhale and lengthen your spine. Exhale, when you twist gently, baby twist, then chest, then head. Just micro movements. Inhale and you lengthen. Exhale, micro movements of a twist. And gently come out of that. Switch your leg positions. Use your arms to lengthen. Inhale, exhale, twist. Baby, chest, then head. This mobilizes your spine in rotation. It strengthens your internal and external obliques. It can relieve low back pain. It increases blood flow to the adrenal glands, uterus, and ovaries, and stimulates the intestines. And then we'll end today in a squatting position. You can use a stool, you can use a bolster, you can use a yoga block. If you're real flexible, you can have your bottom toward the floor. You'll have your hands in prayer position and just allow your pelvic floor to open. Let your feet be flat. Your thighs are rolled outward to open the pelvic inlet. Your breath is steady. This is promoting both strength and flexibility in the lower body. It's making space for baby to assume a more ideal position. Feel the opening in the pelvic floor. You might for a moment just tighten the pelvic floor, anal, vaginal, urethral opening, and then release the pelvic floor. Feel the difference between tightening and releasing. A few more breaths there. Then come out of that position, placing your hand on your baby, sending your baby some love, meaning gratitude for your baby inside you, patting yourself on the back for doing some movement today.